You know, we've got the David Eby response to Tara Armstrong's first clip, and they say, oh, this is anti-vax nonsense, and people are skeptical now writ large of medicine, and it's because of how the government handled COVID. So if they're worried about the rising anti-vax sentiment, look in the mirror. That phone call's coming from inside the house. Let's go to this clip. It's a little bit long. It's 3 minutes, but Wyatt rightly sort of paved the way for this. And then we have some other crazy things in the legislature after we respond to this.
Years, this government's reckless and unscientific COVID mandates have driven more than 7,000 healthcare workers out of the system, gutting frontline care and putting British Columbians' lives at risk. Even after walking back these mandates, the government doubled down, forcing workers to disclose vaccine status, reapply for their own jobs, and return to work with not a penny of back pay. And unbelievably, they're still holding the threat of new mandates over their heads. Our healthcare system has crashed and burned under the weight of critical staff shortages that this government has created. So my question for the Minister of Health is this: will she finally admit that her government's COVID mandates damaged our healthcare system and that it was an unforgivable betrayal of the very people we rely on to keep us healthy and alive?
Mr. Premier.
Thank you, Honourable Speaker. It's hard to think of a better example of the challenge of discussing public health care, the need to protect vulnerable kids and seniors who are in healthcare environments and long-term care and hospital. It's hard to think of a better example of how hard it is to have these conversations in this House with an example of the ideology that has been brought into this House by the Conservative Party. This anti-vax philosophy, which has no grounding in science, proposes to send unvaccinated workers into our long-term care facilities and hospitals with children who are fighting cancer, with seniors who are clinging to life, and expose them to COVID and the flu and measles. It is incomprehensible. It is unforgivable. Raising anxiety among British Columbians about vaccination right at the beginning of flu season. Right at the beginning of flu season, when we need people to go out and get vaccines to protect vulnerable populations, an act of service for all British Columbians, to attack that act of service, to say that it is problematic and wrong, it's a betrayal. And that ideology was brought into this House by the Conservative Party, and I think they owe British Columbians an apology.
That member who asked the question belongs to One B.C, not Conservative Party, so please have a supplemental. Thank you.
I actually do appreciate that myself, for the distinction. Thank you very much. Thank you very much, Mr. Speaker.
Okay, I think we'll go to Wyatt first, obviously. But yeah, did you know it's an act of service to get a flu vaccine?
It's a sacred time of year.
It is the most wonderful time of year if you work for Big Pharma. But this goes to my point during COVID, where I repeatedly said the lines on the floor and the vaccine Band-Aid selfie photos. The most useless people in society are the ones following those rules and posting those photos, because they don't do anything for anybody else. They won't help an old lady cross the street. They won't shovel somebody else's sidewalk. They don't do anything good in society, but they get told, if you get this vaccine, or if you follow those stupid lines in the grocery store, and if you scold other people for not doing it, you are akin to a firefighter. You're saving lives. You're rushing into a burning building. You're the real hero. And so the most useless, selfish people in society, they leapt on that. And that's why they don't want to let it go. Because without all that stuff, they just go back to being the losers in the neighborhood. Anyways, I'll be quiet. Go ahead, Wyatt.
Well, there was
What if those who were once called conspiracy theorists turned out to be right again? A new study by Korean doctors claimed that COVID vaccines raise the risk of 6 cancers, including lung, breast, and prostate. Researchers analyzed health records for more than 8.4 million adults between 2021 and 2023, and their findings were published in Biomarker Research, a respected scientific journal. Critics dismissed it, but the data raises concern that spike protein exposure may be tied to long-term health risks. Dr. Peter McCullough has been aware of this since 2020, which is why he collaborated with the wellness company to create Ultimate Spike Detox, designed to help your body clear spike proteins, reduce inflammation, and support heart health. With natural ingredients like nattokinase, dandelion root, and bromelain, it is your daily proactive defense for a man-made virus. Don't wait until symptoms strike or something unexpected happens. Experience the only formula approved and used by Dr. McCullough, one of the top doctors who risked it all. Head to twc.health/rebel. Use code REBEL to get 10% off free shipping. Again, that's twc.health/rebel and use code REBEL to get 10% off. Get back to that pre-COVID feeling.
Multiple distinct lies there from David Eby. One, notice how, because Tara Armstrong pointed out, one, it's egregious that when you're rehiring the forced out workers, that you're going to force them to jump through a bunch more hoops just to get their jobs back. And at times they still said no, and then people had to go to their local MLAs to put pressure on the health minister to make a big enough deal to hire them back. But if he's so terrified, if we were supposed to be terrified of somebody who has not gotten every single vaccine on the planet working in a hospital, why is he hiring them back? It's almost like he knows the bigger health concern here, if he actually even considers the vaccine one actually something he really cares about in his head, and it's not just a political thing for a political stump for him to stand on. But if he actually thought that there was a risk, he wouldn't let any of them come back.
Right.
He's letting them come back because obviously it's a bigger threat to people's health to not actually have ERs open, and they keep shutting down all over British Columbia because of understaffing. At the same time, they're building a new hospital in Vancouver where out of, I believe, the 5 or 6 floors, more floors are dedicated towards office supplies and desks rather than actually treating patients. And then another thing they said is that he said that we can't allow people who are not vaccinated around the elderly and children in cancer wards. It's like, well, again, only about 1/3 of all people who work in the health system actually get vaccinated. Even if you go into intensive care, it only goes up to 2/3 because, again, there's a lot of doctors out there, even with all the pressure that you should do it every year to model good behavior. A lot of them are like, it doesn't even help you. It makes you feel crappy oftentimes for a few days. So what is even the point? But I was also thinking right there, aren't you in favor of MAID and abortion? And now he's talking about the lives of the elderly as if he actually cares. This guy couldn't care. Like, he sees them as more so disposable votes than actual human beings.
Well, and given the choice of who cares for your grandma, right? Like, the vaccination of your grandma's care is literally 8th to 10th on my list of priorities.
Right.
You know what I mean? You want somebody that's competent, that's compassionate, that is good at their job. Like, their vaccination status and what they've done is inconsequential to the overall scheme of things, and why we are crowding them out when they could be providing care to the people of BC. It's egregious. It's egregious.
And again, was the implication there from the Premier that if you're not getting your flu vaccine every single year, despite the fact that at best you're going to get 40% effectiveness rate against the main flu that year, at best you're going to maybe have it block you against one flu strain? Is the implication that those who have not been vaccinated for the flu every single year are now going to start to be forced out of the system? Because that's effectively what he said. Because again,
because they're a danger. Because they're a danger.
Yeah.
Wyatt, Claypool. Yeah.
But pushing MAID on people in hospitals is not a danger, even though that's happening all over the place. Literally, actively pressuring people to end their lives is actually helping people.
Yeah. And making Catholic hospitals build walkways so that their patients can be taken off to the MAID facility, the euthanization room.
The abattoir.
The grandma abattoir, exactly that. You can see that in David Eby's world, compliant healthcare workers are more important than caring or competent ones. I'll go to Sid.
Yeah, compliant and trusting of government. I mean, that's the whole idea here. Is if you trust the government, you become a good person, and that's not how it works. And I think the point that, we're bringing it to with maids here is the perfect point to make, and it's the fact of this is the direction our healthcare is going in. Instead of looking to solve your problem, they're looking to end your problem, which is you, inevitably.
Right.
At least, that there's some carbon offsets there. I wonder if they're blending that into the maids program so it's environmentally friendly. But it really is the trajectory we're going here, where they don't actually care about your health. They want you to subscribe to whatever it is they're putting forward.
Yeah, I forget the name of the group, but it's like doctors, like Doctors for Climate Change or whatever. There's that activist doctor in Alberta. I forget his name, but I just recall he was like, everybody has to stay home and wear a mask. And then I'm like, well, what are you doing at the UN Climate Change Conference all way across the world right now then? Oh, God, I forget his name. Not that it matters, but his daughter is one of those kids who sues the government over us ruining her future. How dare we? So there is some, like you say it jokingly, but they do actually, there is a subset of these radical ideologues who care about your carbon footprint in healthcare. And that is, I think, which it should be our last concern.